First of all, I'm going to have Tara introduce herself in a little bit. You guys obviously heard her last night speak about her life. Can we give her a round of applause, too, for that? And if you go ahead, Ethan, will you throw her family picture up there? Yeah, there we go. And then I'm just going to have Tara kind of like just briefly introduce herself and why I have her up here, and then we're going to dig into some of the deep stuff.
Awesome. Okay, if you were here last night, you remember, but if not, a refresher. Yeah. I'm Tara Kegeris, and I am a wife, a mother, a sister, a friend, a child of God, and an owner of a faith-based healthcare practice in Avon, Indiana. This is my family, my Adorable. Super handsome husband. And in case you don't know which one that is, because it's the second one over. 27 years we've been married. Thank you. And then my oldest son, Luke, and his beautiful wife, Katie, and my stunning daughter, Anna, which this is not photoshopped. And if you don't believe me, they're right there. They are just as beautiful in person. And then everybody calls the one on the right the favorite, and his name's Eli. So that's my family. And I have owned Mission Health and Wellness, a faith-based practice in Avon, Indiana, since 2021. So I have the blessing of doing that as well.
So with Mission Health and Wellness, you guys have seen her videos. How did this kind of come into fruition for you?
Sure, perfect. So I had been a nurse for 18 years, a registered nurse, and then God just really prompted my heart to go back and further my education. And so I worked in primary care as a primary care provider at AHN in Avon, and really loved that, but wasn't content with prescribing a medication for everything, always having to do that. And I will say specifically, I love people. If you know me, I love you. And one of my patients had come and, you know, I had the kind of classic PCP thing. Here's a prescription for all of your complaints. And she came back to see me for a follow-up, and she was feeling so much better. And I was like, oh, great. Was it like the antidepressant I put you on or the blood pressure medicine? And she was like, Tara, I love you, but it was nothing you did. Yeah, I was like, oh, cool. Ouch, yeah. So then I was like, well, what is it? Well, she had went ahead and sought out integrative medicine somewhere else and told me we really just worked with my body naturally and got me back to a state of wellness, and this is where I am now. So that just really put something in my heart that I want to be a part of her feeling better. I don't want her to go other places, or I want to be a part of that. So then I started getting my continuing education, which we have to get as healthcare providers, in functional and integrative medicine. And then, honestly, you can't unknow what you know. And so then I was just no longer content in that. And the Lord just kept opening doors and just even leaving me with more discontentment. So if you're ever wondering what God has for you, don't miss peace or lack of peace. And I had an overwhelming feeling of a lack of peace. And then that was a dream in my heart, Mission Health and Wellness.
And so I feel like you covered most of this because you kind of talked about how it kind of inspired you to leave like the traditional healthcare model and start your own practice, is what it sounds like, is how you got started. So with integrative medicine is what we're talking about. In your own words, how is that different than the conventional care? You kind of touched on it, but let's unpack that maybe just a little bit more for you.
Yeah, so integrative medicine is honestly the best of both worlds. It's functional medicine and conventional medicine. So there's a time and a place for conventional medicine. So if you came to me, which people do come to me, like, and you're like, your leg is hanging off because it's like been partially amputated, I'm probably not going to go, here, take some of these supplements, or you're probably going to need that. So it is science, evidence-based medicine, and natural healing. And then it just works together to do what your body was created to do, and that's heal. God gave us these amazing bodies to heal. So for me, I wanted to be able to do that without the restrictions of time. I mean, if you've ever been to your provider, you know there's a time restriction, an insurance restriction, all of these things. And then there's also the faith restriction. And so I wanted to be able to have a practice that Jesus was the foundation and I wasn't limited by anything else. So
I love that. And the thing that, like, as a new NP myself, I love hearing the fact that you're not throwing supplements for things that maybe require more than a supplement. Yes. But I love, like, the additive, the fact that there are preventative things that we can do to help our health. Because I was talking to somebody one time and they were like, well, they throw medicines at me. And I said, I'm going to be honest, sometimes there's some people who don't want the preventative or change the lifestyle or do that. So then the medicine is that option if you're not willing to change some of the other stuff. So I think preventative care is something that I think is great, and that the fact that you kind of merge the two together. I love that. Sorry. I just want to put my own 2 cents there.
Oh, thank you.
And then real fast, so we talked about the conventional care, and then the primary focus of mission. You kind of touched on this too. It sounds like we can go there for just about everything. Okay. So I didn't know if there's more that you wanted to say about that, but it sounds like I can go if I feel like I have a sinus infection or whatever it might be, and we can go for a lot about both. So I won't go unless you want to say more about it.
You can. Definitely we have a specialty, and we are experts in bioidentical hormone therapy, gut health, and the gut has to do with everything else because 90% of the serotonin in your brain is made in the gut. 70% of all disease comes from the gut, including autoimmune disease, which is responsible for lots of other things. Weight loss, IV therapy, lifestyle interventions, preventative medicine. So a lot of people will say, well, can you just be my PCP? Or a lot of people have followed me from AAHN. Yeah. And I don't recommend that for a couple reasons. We don't have on-call services. So that's the thing about your PCP, that you can call after hours and they can get a hold of you. And then a lot of people want to use their insurance. Like, okay, if you came and you're having chest pain and you need this cardiac workup, well,
come see me.
Yeah.
Because I'm in cardiology.
Come see Jordan. Yeah. It's going to be a pretty expensive workup if you're going to go to a place that doesn't accept insurance and things. So
yeah, thank you. Because that is, I think, what some people, like, okay, how do I integrate this into my own healthcare right now, and like what's appropriate, and obviously what's not. Yeah. And then you kind of touched on hormones. So what are hormones, and why do they matter for our overall health, especially as women?
Yeah, good. I love that. Hormones are your chemical messengers for everything. So they matter for everything from how your brain functions, for your bones, for your heart health. And then they matter for symptoms, brain fog, headaches, bloating, fatigue, and then all the things people think of with hot flashes and all that. But your blood pressure rising, gaining weight, visceral fat, which is fat around your organs, your glucose and your blood sugar. So your hormones are chemical messengers for everything. And when those are balanced, our bodies function well. When they're out of balance, we don't function well, and most people can recognize that. The problem is you go and may not get the root cause treatment, and then you just leave with a Band-Aid, and you're like, I still don't feel well. So
something that you guys do is bioidentical hormone therapy. So can you kind of touch on what bioidentical hormones are?
Yeah. Bioidentical hormones are plant-based hormones, typically made from yams or soy, and they are compounded to match your body molecularly to your body's natural hormones. So they mimic what your body does naturally, unlike a synthetic hormone that is manufactured. And a manufactured hormone is typically made from pregnant horse urine. And
Getting real
yeah,
here.
we are. It's called Premarin, so pregnant mare urine. Is how they came up with that name. And it's about 10% hormone and the rest, all the other stuff. So it's really completely different, but people extrapolate them to be the same, and they're nothing alike. It would just be like saying an ape is like a human. Yes, we can have very similar DNA, but we're nothing like that.
So with hormones, you did kind of touch on this too, but like how does the hormonal imbalances maybe show up in our day-to-day life? You talked about brain fog. Are there any other ways that you feel like it shows up that maybe we just miss and we think is normal for us, our new normal?
Yeah, I think a lot of times fatigue is a big one. Lack of focus or mood, so the ADD or ADHD that people are going to be seen for. Depression and anxiety, that's a big one. Again, bloating, migraines, increase in PMS symptoms or change in periods, joint pain. They're really palpitations. That's a big one. People go to conventional medicine for and you probably get this a lot, Jordan. You're like, everything's fine. And so that's a big symptom of hormone imbalance. And so I think that, a lot of symptoms that people have, a lot of times it is just an imbalance of hormones. And we also have to keep in mind when it comes to hormones, they really are the best longevity tool that we have in medicine. And I say that because I can say that clearly with all of the other things in our toolkit, conventionally and functionally, we function best when our hormones are optimal. And just think about being at a healthy hormone level where you have the best energy, the best focus, you can concentrate, you have lots of just oomph for life, your mood is good, all of the things. Like, think back to that time. Now, some things interfere because we live in a world that we have, baggage and different life stressors that come. But when we are at our best hormonally is when we function best. So it really is the best longevity tool that we have in our toolkit.
I'm sitting here thinking, oh my gosh, like maybe I have some of these symptoms and maybe it's hormone. And I'm like 35, 36. I think I'm 36. Anyways.
You do. I agree with your mom. You do.
So, sounds like I need to see Tara.
Yes, you do.
So, I'm 36, and I'm thinking, like, man, this could be me. So, about what age do you typically see, like, some of these patients come in and, like, oh, this could be me? Like, what age are you seeing?
Yeah, that's a great question. Typically, early 30s, I would say.
I'm there.
It starts.
I'm, like, late 30s now.
Yeah. Definitely we can start to see those changes and leading into perimenopause and menopause. So perimenopause is this period, and it could be 10 or 15 years where you go through progesterone deficiency. So you're still making adequate estradiol, which when we're making adequate estradiol, this estradiol's high and our progesterone is low. That's the first hormone that we lose as well as testosterone. So now due to high levels of estradiol or estradiol levels that are going like this, like ovulate, don't ovulate, ovulate, don't ovulate. Then you have all these symptoms and no progesterone to balance or offset that. Well, estradiol is a stimulating hormone, so that's where anxiety can come in, palpitations, things like that. When if we could just take progesterone, that would offset that. But I also see many teenagers, and I think that teenagers and young adults in their 20s often get overlooked because they're having many of those symptoms from making too much of their own endogenous estrogen or testosterone. And so then they go to their primary care provider or their gynecologist and they say, I have all these acne and I have this bloating and really bad PMS and migraines and depression and anxiety. And what are we trained to do? We're trained to put them on birth control pills, antidepressants and anti-anxiety medicine and migraine medicine, when really it was a progesterone deficiency. And if we would have just given them progesterone, we could have fixed the problem without adding all those other risks. And that is the same with postpartum depression. I've seen it happen before where suicidal, wanting to kill themselves or their babies. And so then they go to the ER and they get a shot of some sort of, anxiety medication. And if you gave them a shot of progesterone, gone. Because you're pregnant and you have the highest level of progesterone, and that causes endorphins to be released and this feeling of euphoria, which people often think, I'm so happy because I'm pregnant. Well, it's really because you have high levels of progesterone, and then the minute you deliver, it's gone. And now you're miserable and you're like, why did I even have a baby? And you are suicidal, and you just needed to find someone who understood that and get progesterone.
Like, where were you when I was a teenager? I have PCOS myself.
Yes.
And so, like, some of the tests, like my testosterone's through the roof with PCOS, of course, put me on birth control. And it manages for a while. But yeah, I think there's other things that could be done, obviously. Yes. But that, that was years ago, so we didn't have all of this. It's now kind of coming to a forefront where people are like, oh, like, there's this integrative medicine. So I love that you touched on that. And I know you see PCOS patients too, which we won't get into, because those of you who do have PCOS, you do know that it's quite the endocrine disorder. So I won't keep going on that. But when we're talking about the BHRT is what I'm going to refer to it as, and this is just talking about the bioidentical hormone replacement therapy. There are a lot of things out there. People are afraid to do that because of the fear of cancer, heart risk, or other fears. For you, what does the science say about all of these things that we worry about?
This is one of my favorite questions, but I'll try not to be up here all day. And I will touch on PCOS when I get a minute. I might throw it into this question. So the biggest fears came from the Women's Health Initiative study that was done in 2002. And when they did this study, they had thousands of women that were entered into this study, and they gave them CEE, conjugated equine estrogen. Remember, that's the horse mare urine. And they gave them medroxyprogesterone, which is synthetic progesterone. Now, if you Google both of these, which is very frustrating, if you Google estradiol or progesterone, it will tell you the risks and everything based on CEE and medroxyprogesterone, because that's what they're extrapolating. They don't have those, and the FDA doesn't approve those, so then they will put that's the symptoms for that. Completely different. Go back to completely different. So in the Women's Health Initiative study, when they did that study, they found in women over 65, there was an increase in MMP when taking oral estrogen and oral synthetic, so these are both synthetic, progesterone, which was the medroxyprogesterone. I'm going to call it progestin. So when they took those together, in women over the age of 65, it increased matrix metalloproteinase, which is MMP. When MMP was increased, from taking these medications, they are not bioidentical. In the first year of use, there was a slight increase in risk of a cardiac event. The women didn't die from the event, but there was a slight increase in that event as well as cancer. And so they halted the study. They stopped it. Within 2 years, they had all of these studies. They had the nurses study, Elite, DOPS, KEEPS, Esprit, EPAT. I'm sure I'm leaving out some. But unfortunately, this wasn't on the news that they said, oh, we messed up. It was the medroxyprogesterone, the progestin, when taken with the estrogen, that increased that risk of cancer. When they removed that from the women that were taking it, there was actually a decreased risk of breast cancer. It was apoptotic when we took, and I'm talking about synthetic estrogen, it was actually decreased breast cancer when they took away the progestin. But in those women that were 65 and older, especially the ones that smoked and were obese and had plaque, in that first year of use, it increased their risk of that event or clot to 1.8. Anything over 1 is a risk. Anything below 1 is actually a protective mechanism. Because of the MMP, that's what happened. So they said, okay, we're not going to do this, and took it away. The thing is 90,000 women died when they took them off of it. Most of them were already past their year, and because the risk was so small, they're like, was it even significant at all? My input on that with all of the other trials in that is, well, then use estradiol and progesterone, which are bioidentical, and in every single study, like all of those I just named, it protected you. It protected your heart. It protected you from cancer. It did. But again, we're working around the FDA that says we just want to use pharmaceuticals, and we saw this increase in risk. However, because I know what I know about hormones, if I could not afford bioidentical or I did not have access to them, I 100% would take synthetic hormones. Because I know from the studies it decrease any kind of cardiovascular risk for the future. They protect your bones, your brain from Alzheimer's. So when we look at studies when it comes to cardiovascular disease and breast cancer, everybody's afraid of breast cancer, right? Because of the pink ribbon and all the things. 1 in 3 postmenopausal women will die of cardiovascular disease. 1 in 3. That's like a lot of you. 1 in 38 will die of breast cancer. To me, that's a significant eye-opener to, okay, I need to take my hormones. We do not need to be without our hormones. Now, the answer is bioidentical hormones. Then you don't raise your risk at all. But that's what the science says. And unfortunately, people don't know the science because Women's Health Initiative study came out and they didn't post anything else about it.
I'm sitting here just like soaking it all in, just so you know. I'm just like,
okay.
yes, yeah, I'm getting it. And it's something that, like, even just me going through my education, something that was brought up multiple times is women's health is not studied as much as it should be. And a lot of these studies, too, it's not just women, you know? And I think that I do see an increase somewhat, but for women's health in general, we are different creatures. We are made different. And a lot of these studies that even I'm learning in my education are not women specific, to the point where in my education, we have specific women's consideration, obstetric considerations. So to tack on that, I think it's very important that women's health be looked at it on a deeper level, like you just said. And so when we're starting the BHRT, is it true that you should take the lowest dose for the shortest period of time?
I love that. And the answer to that is, why would you do that? And that is because of what I just talked about. The reason they said that is because of the women over 65 who had that. But again, it still doesn't make sense. We have to think. We really do have to think when we make decisions and be the best advocate for ourselves. Because remember, I told you, these women, to take them off or take it to for the shortest period of time, you're now losing all of the benefits. The longevity benefits of protecting you from osteoporosis, fractures, cardiovascular disease, cancers, dementia, and Alzheimer's, they only work while you're taking them. So why would anyone stop them? In every study, including the Women's Health Initiative, it shows these only protect you from these things while you're taking them. So I'm not sure why they would have said. I think it is just the fear, the lack of education and the fear. I mean, we definitely have a big fear thing going on when it comes to that. Just because of the lack of education, like Jordan said, we get about 10 minutes of women's health in school. Is that the saddest thing? 10 minutes. And that 10 minutes is pretty much birth control pills, which, fun fact, is where we see the risks of clots and strokes. But that's what we're trained to prescribe, and fear everything else that the studies don't support that doing. So yes, why would you ever? And when people say, when should I stop my hormones? When you're 120. That's my answer.
If you make it that far. And if you do, that's great.
If you come see me, you might. Thanks.
Okay, so why doesn't my doctor tell me about BHRT, or why does my doctor talk negatively about it? You may have just touched on it a little bit.
Yeah, I think that it is the lack of education. I think that when we're not trained, we fear what we don't know. And I was in that same boat. That I didn't. We are trained in our med schools, and our training is sponsored by pharmaceutical companies and insurance companies. So that's what we look at. And so it really boils down to they don't understand that they don't understand. And if you don't understand, you don't understand. You don't understand that you don't understand. Yeah. If that makes sense.
You don't know what you don't know.
Yeah, you don't know what you don't know. And so it's not that they don't care. It's just they're doing the best they can with the information that they're allowed to do, because we are trained. This is what we do. We have protocols and algorithms. We don't really have the time in that world to go outside of that unless you're planning on changing jobs.
It's funny that you mentioned that, because just last night I was talking to Marilyn, wherever she's at. Oh, there she is. So I got my B12 shot this morning. We were talking about it last night. I did.
Awesome.
I did. But we were talking about it last night, and she's like, what's B12 for? And I'm like, well, it's energy, and it does help with, like, some weight loss. I'm going through. She's like, didn't you just go through school? But I'm like, yeah, but, like, they don't cover all of that stuff. It's a breeze in the wind in education, because, like, I mean, to be fair, they're trying to make us competent in all areas of all of the whole body in a very quick time, and then you learn all the other stuff on the job. I'm competent, by the way. I passed my boards, but I'm just saying. That, like, the deep nitty-gritty stuff about supplements and vitamins and stuff, I said, we brush on it. I said, but, like, Tara's your girl to talk about, because, again, you did more medical education on, like, the supplements and integrative medicine, functional medicine. So that's not something that you're getting in your regular education. So then when the advice that you would give someone about if they're feeling dismissed or unheard by their provider might just be something simple, like I just said. Like, they don't get a deep dive into all of this. So if someone's feeling that way, like, how would you approach that?
Yeah, I think that you, like I said, have to advocate for yourself. And I will a lot of times tell my patient, try to work with your provider and saying, will you support me in my decision to seek care doing this? If your provider doesn't, I say you find a new one. You are the best. Yes, you are your best advocate. And I'm not trying to talk bad about your primary care provider, but they are limited on what they can do. And if they truly love and care for you, they will support you. Now, it's okay for them to say, I don't understand that, and I'm not going to do it, but I'm going to support you in your decision to do this, and that is how we can care for you best. Because I do think that it really is, when they give pushback or they don't tell you because they may not know, because it's just not a tool in their toolkit, and they push back because, like we said, they fear what they don't know. And that does take me to the, you have to, if you don't know, you come see me, or you do your research. And it has to be more than Google, because Google is censored. And it is definitely a FDA thing. So you have to go get good, and if you call me, I'll help you get good evidence based research, because that brings me to, and I do want to bring up PCOS and that for a minute, that cancer is another concern that people bring up. But remember I said cancer decreased in the studies when we gave bioidentical hormones. As a matter of fact, there are research studies I put on my website, and you can click under research and education, that there is a breast oncologist, Rebecca Glazier. She actually implants testosterone implant pellets around active breast cancer, and it kills it. She is very good at showing those studies, but the problem is people Google it, and then they get an FDA label, and it's not based on studies. And so, do hormones cause cancers? Yes and no. Yes, synthetic were linked with some cancers. Yes, if you have too much unbalanced hormones that you make on your own. Like I said, you have a progesterone loss. Yes, you have estrogen, what people would call dominant, too much compared to that. You are at risk for cancer. Too much testosterone, PCOS, risk for cancer, but it isn't actually the testosterone. It is the underlying insulin resistance, visceral fat that is driving up the testosterone, increasing your risk for cancers. In every single study, when we actually give testosterone, even to women who have PCOS and an increased testosterone, it did not cause any increase in anything. So it really is a matter of thinking about things. Why don't women have heart attacks until menopause? Yeah. Right? Because they have no estradiol. Why do men have more heart attacks than women? Because the only way a man gets estradiol, which it is just as protective in a man, the only way a man gets it is from the downstream of his testosterone. So as he ages and his testosterone goes down, well then guess what? The only estradiol he had went down. That's why men have heart attacks younger, why women don't have heart attacks till menopause. Estradiol is what protects them from that. So it really is a matter of also thinking about cancer. Why does our risk for cancer go up when we age and we have no hormones? We're so afraid of hormones, but they protected us. We don't get those cancers when we're 25 and our hormones are optimal. So it really is thinking not out of fear, thinking logically, and then getting good studies. Here's an example of a study. Okay, we need to get high caliber studies when we are learning things and not just believe what we're told. And so there's this study that says popsicles increase skin cancer. And so the study was done that they had their control group that did not eat popsicles, and then they had their other group that they picked in the controlled study. They would sit outside at the picnic table and eat a popsicle every day. So the study result came out and said that eating popsicles daily was associated with an increase in skin cancer. Does anyone else think sitting outside in the sun at the picnic table?
Correlation, not causation.
Perfect. So that is that. So many people think, I read this study and it said it was associated with or correlated with, like Jordan said, association and correlation is not causation. The popsicle did not cause the skin cancer. So we really have to educate ourselves on, are we reading good studies when we're making our healthcare decisions?
So I'm going to wrap 3 questions into one. Labs, they come back normal. Mm-hmm. Why does my doctor say it's fine? Mm-hmm. And then we're going to try to wrap these questions into, with those labs, how do I integrate supplements to detox tools, and how long does it take to see results?
Okay. Good. So I get that question a lot. I went to my doctor. They said my labs are normal, and there's nothing that can be done. Well, you were fearfully and wonderfully created by a maker who has all different points, unique thresholds in our body. So if you are feeling off, God has designed you with a body that says something's not right. And just because your labs are normal, I think people don't realize that labs that we're given are created for a 95% bell curve. And if you fit in that bell curve, you're normal. Okay, the 95% bell curve is the average of people, including sick old people. Yeah. So who wants to fit in that bell curve that the average includes sick old people? We want to be optimal. So there's a difference in optimal. There's also a difference in how God made your body. So I'm going to use thyroid, for instance. Just because you have a normal TSH, thyroid stimulating hormone, just because you have a normal amount of TSH in your body does not mean that your receptors for that thyroid hormone are sensitive to that amount. It works the same way in insulin resistance. So you don't have diabetes and you're producing insulin, but your body is not sensitive to that amount of insulin. Well, why can't we understand all of your other hormones are the same way, including thyroid? If you make plenty of thyroid, we're not saying that you don't, just like you make plenty of insulin. But that doesn't mean that that normal level is a good indication of you have a properly functioning or sensitivity to that thyroid hormone. So I think it is very important to think, my labs are normal, but your labs are normal according to who? According to a grid that says you fit into a 95% bell curve for the average population. But your body is different. God made you different. So I think it's important to, if you don't feel optimal, go see someone that can look deeper.
And just real fast, as we try to wrap up here, so what's your hope for every patient, and then how can they get started? And then after that, we're going to do a quick giveaway for your clinic.
Okay.
So
awesome.
What's your hope for everybody that walks through your door, and how can they get started? And then let's get them started by giving a giveaway.
Okay, yeah, perfect. So my hope for every one of you is that you would feel optimal, that you would also go to a place, it doesn't have to be us, but that you would feel seen, heard, loved, and known, that you would be empowered, even if you just came for education, so that we went through and educated you so that you could take that somewhere else. I would be okay with that, just knowing that whatever time I can spend with you to empower you to take it to everyone else, because we have to do that. We have to stick together. And I know that it is frowned upon, and not to talk about the pharmaceutical or the food market, because I could be up here all day. But I believe, like I said, with the longevity tool that we have, we would be taking less chemotherapy, less blood pressure medications, less antidepressant, less osteoporosis medications, less Alzheimer's medications, if we just optimized our health in this way. So, and you know, like Jordan said, other things too, detox strategies, gut health. There's so much more to us, what God gave us, than just the little things. And so we have to stick together, get the word out, educate people. How long will it take? Usually people feel the effects of optimization pretty quickly. I would say within a couple weeks. But it certainly does depend on your commitment to it. It is a commitment. It isn't just a pill for an ill. It is a commitment that we ask you to do when it comes to lifestyle and exercise and supplementation and dry brushing, like we said, detox strategies, gut health. But if people are committed, you will see results pretty quickly.